The emergency room was chaos. Nurses running, machines beeping, lives hanging in the balance. Then, an elderly man collapsed near the entrance. When the doctor checked his wallet, she found something that made her hands shake. Welcome to Dream Blaze. Before we begin this powerful story of hidden identity and medical miracles, tell us in the comments, where in the world are you watching from? And if you believe stories like this deserve to be heard, hit that subscribe button. St. Mary's General Hospital never slept. The emergency department hummed with constant activity. Ambulances arriving, families pacing in waiting rooms, medical staff moving with practiced urgency between curtained beds. It was 3:17 p.m. on a Tuesday, the kind of afternoon when everything seemed to happen at once. Dr. Sarah Chen had been on shift for 14 hours straight. Her scrubs were wrinkled, her hair escaping from its ponytail, but her focus remained sharp. She was one of the youngest attending physicians in the hospital, having finished her residency just 2 years prior. Brilliant, dedicated, but still learning that medicine was about more than textbooks and procedures. The trauma bay buzzed with controlled chaos. A car accident had brought in 3 patients, keeping every available nurse and doctor occupied. That's why nobody initially noticed the elderly man who had been sitting quietly in the corner of the waiting room for the past 2 hours. He wore simple clothes, faded khakis, a plain white shirt, and a cardigan that had seen better years. His gray hair was neatly combed, his posture straight despite his obvious age. He didn't complain about the wait, didn't approach the reception desk repeatedly like other patients. He simply sat, hands folded, watching the organized chaos with patient eyes. The nurses assumed he was waiting for someone else, perhaps a family member being treated. The security guard had nodded to him earlier, but thought nothing more of it. In a place where crisis demanded immediate attention, quiet dignity often went unnoticed. But something was wrong. The man's breathing had become shallow. Beads of sweat appeared on his forehead despite the hospital's cool temperature. His hands, once steady, began to tremble slightly. Still, he said nothing, asked for nothing. It happened without warning. One moment he was sitting upright, the next he was falling forward, his body crumpling to the waiting room floor with a sound that cut through the surrounding noise. His head struck the tile with a sickening thud that made several people gasp. "Code blue in the waiting room!" someone shouted. Dr. Chen looked up from the patient she was treating, saw the commotion, and immediately rushed over. The elderly man lay unconscious, his breathing barely perceptible, his pulse weak and irregular. "Get me a gurney now!" she called out, dropping to her knees beside him. Her hands moved quickly, checking vital signs, assessing for obvious injuries. "Sir, can you hear me?" "Sir?" No response. As nurses arrived with equipment, Chen began her assessment. She needed basic information: name, age, medical history, medications, emergency contacts. Her hands moved to his pockets, searching for identification. His wallet was in his back pocket, worn leather that spoke of decades of use. She opened it quickly, looking for a driver's license or insurance card, something that would tell her who this man was and what might be wrong with him. What she found instead made her freeze. Behind a plastic window where most people kept their driver's license was a medical identification card, but not just any medical ID. At the top, in bold letters, it read, "Physician License, State of California." Dr. Chen blinked, looked again. The name read, Dr. Thomas Anderson, M.D., born 1943. License number active since 1970. Her hands trembled as she continued reading. Specialty, cardiac surgery, hospital affiliations, Harvard Medical Center, Johns Hopkins, Mayo Clinic. But it was the line at the bottom that made her breath catch. Emeritus Professor of Cardiothoracic Surgery, Harvard Medical School. This wasn't just any patient. This was Dr. Thomas Anderson. Even as a young physician, she knew that name. He was a legend in cardiac surgery, a pioneer who had developed techniques still taught in medical schools today. His papers were cited in textbooks, his innovations had saved thousands of lives, and he had been sitting in their waiting room for 2 hours, alone, saying nothing. "Get him to Trauma Bay 1, immediately," she ordered, her voice carrying new urgency. "And call cardiology, now." As they lifted him onto the gurney, Doctor, Chen couldn't shake the image of this giant of medicine sitting quietly in their waiting room, too polite to demand attention, too humble to mention who he was. The transport to the trauma bay took 30 seconds, but it felt like forever. Dr. Anderson remained unconscious, his vital signs concerning but stable. As soon as they were behind the curtains, Doctor. Chen began a more thorough examination while nurses attached monitors and started an IV. "What do we know about him?" asked Dr. Martinez, the senior cardiology resident who had responded to the call. Dr. Chen held up the medical license with shaking hands. "We know everything and nothing. This is Dr. Thomas Anderson." Dr. Martinez went pale. The doctor? Anderson? The one who pioneered the Anderson technique for mitral valve repair? The same. Word spread quickly through the emergency department. Within minutes, department heads began appearing. Dr. Patterson, the chief of cardiology, arrived still wearing his surgical scrubs from another procedure. Dr. Williams, the chief of medicine, came from a board meeting. Even the hospital administrator appeared, having heard whispers that someone important was in the ER. But Dr. Anderson remained unconscious, oblivious to the gathering crowd of medical professionals who considered him a hero. Dr. Chen ran through the diagnostic possibilities. At his age, it could be anything: heart attack, stroke, medication interaction, diabetic emergency. Without knowing his medical history, they were working blind. "Has anyone found emergency contacts?" she asked. A nurse shook her head. "Just the medical license, no family information, no personal contacts. That's when someone noticed something else in his wallet. Tucked behind his credit cards was a small, folded piece of paper. Dr. Chen unfolded it carefully. It was a list, handwritten in precise script. Daily medications, none allergies, penicillin emergency contact, none available medical history, see attached." But there was no attached document, just a single line at the bottom that made everyone in the trauma bay go silent. "If unconscious or unable to speak, please know that I have chosen to spend my final years quietly. I have given enough to medicine. Let others have their turn." The room fell silent except for the steady beep of monitors. Dr. Patterson stepped forward, his voice quiet. "Run a full cardiac workup, CBC, comprehensive metabolic panel, cardiac enzymes, EKG, chest X-ray. And get me his medical records from Harvard. They should have his complete history." As the medical team worked, Doctor, Chen couldn't stop thinking about the note. Here was a man who had dedicated his life to saving others, who had trained hundreds of doctors, who had pushed the boundaries of what was possible in cardiac surgery. And he had been sitting in their waiting room, probably experiencing chest pain or cardiac symptoms, too humble to mention his credentials, too respectful of their busy schedule to demand immediate attention. The test results began coming back. Elevated cardiac enzymes, EKG showing signs of a heart attack, not massive but significant. His heart, the same heart that had guided countless surgical procedures, was failing him. Dr. Anderson began to stir as the medication took effect. His eyes fluttered open, confused and disoriented. "Dr. Anderson," Dr. Chen said gently, leaning over his bed, "you're insane. Mary's hospital. You had a heart attack. We're taking good care of you." He looked at her with eyes that had seen decades of medical practice and smiled weakly. "I was wondering when someone would notice," he said softly. "Sir, why didn't you tell us who you were when you first arrived?" He shifted slightly, wincing from the chest pain. Because that young man over there, he nodded toward a medical student observing from the corner, needed to learn how to treat a patient, not a reputation. And that nurse, he gestured to the woman adjusting his IV, needed to practice her skills without the pressure of knowing she was treating someone famous. Dr. Chen felt tears welling up in her eyes. Even in his medical crisis, Doctor. Anderson was still teaching, still putting others' learning ahead of his own comfort. Besides, he continued with a slight smile, I've been on the other side of this bed many times. I know you're all excellent physicians. My name wouldn't have changed the medicine. Dr. Patterson approached the bedside. Tom, you stubborn old fool. Do you know how many people in this hospital owe their careers to your teaching? Dr. Anderson chuckled, then winced again. And every one of them learned to treat patients with respect and dignity, regardless of who they are. I wasn't going to undermine that lesson by demanding special treatment. Over the next few hours, as doctor, Anderson stabilized and was moved to the cardiac unit. His story spread throughout the hospital. How he had been waiting patiently for hours, how he had collapsed without complaint, how, even in his medical crisis, he had been more concerned about the education and growth of young medical professionals than his own comfort. Nurses who had walked past him in the waiting room stopped by his room to apologize. Medical students asked if they could observe his treatment, not because he was famous, but because they wanted to learn from his grace under pressure. Dr. Chen found herself returning to his room repeatedly, drawn by something she couldn't quite name. During one visit, she worked up the courage to ask the question that had been bothering her. Dr. Anderson, that note in your wallet, about giving enough to medicine, did you really mean that? He looked at her thoughtfully. I meant that I've had my time in the spotlight. I've published my papers, trained my students, saved the lives I was meant to save. Now it's time for your generation to lead. But, he smiled, that doesn't mean I stop caring about the patients or the medicine. It just means I don't need the recognition anymore. But what you did today, waiting quietly, not demanding attention, that taught us something too. What's that? That being a great physician isn't just about surgical skill or medical knowledge. It's about humility, respect, and understanding that every patient deserves the same level of care, whether they're a famous doctor or someone homeless off the street. Dr. Anderson nodded slowly. Now you're thinking like the physician I hoped you'd become. 3 days later, Doctor, Anderson was discharged with a new pacemaker and strict instructions for cardiac rehabilitation. As he was wheeled toward the exit, something extraordinary happened. Hospital staff began lining the hallways, not in a planned ceremony, but organically, as word spread that he was leaving. Doctors, nurses, technicians, housekeeping staff, administrators. They all took a moment to stand quietly as he passed. No applause, no speeches, just the quiet respect of medical professionals honoring one of their own. At the exit, Doctor, Anderson asked the transport aide to stop for a moment. He looked back at the hospital, at the emergency department where he'd collapsed 3 days earlier, at the faces of the people who had cared for him. You know, he said to Dr. Chen, who had come to see him off, I've worked in some of the most prestigious hospitals in the world, but I've never been treated with more dignity and respect than I was here. Even though we didn't recognize you at first, especially because you didn't recognize me. You treated me like every patient should be treated, with skill, compassion, and dignity. That's the highest compliment you could give any physician. As his taxi pulled away, Doctor, Chen stood in the hospital entrance, thinking about the lesson she had learned. In a profession that often celebrated the brilliant, the famous, the groundbreaking doctor. Thomas Anderson had reminded them all that the greatest physicians are often those who practice with quiet excellence, who put their patients' needs above their own recognition, and who understand that true healing happens not in the spotlight, but in the countless small moments of human connection between doctor and patient. The emergency department returned to its normal chaos. ambulances arriving, families waiting, medical staff saving lives with practiced skill. But something had changed. The staff moved with a little more awareness, a little more attention to the quiet patients, the ones who didn't demand immediate attention but might need it most, because they had learned that heroes don't always announce themselves. Sometimes they sit quietly in waiting rooms, too humble to mention that they once changed the world, one patient at a time. And sometimes the greatest lesson in medicine comes not from a textbook or a lecture hall, but from an elderly man who collapses in your emergency room and teaches you that the true measure of a physician isn't what they've accomplished, but how they treat others when no one is watching. So I ask you, have you ever overlooked someone who turned out to be extraordinary? Have you met a quiet hero who changed your perspective on what greatness really looks like? Share their story in the comments, because the world is full of Dr. Andersons, people who have given everything to their profession, their community, their families, and who continue to teach us through their humility and grace. If this story moved you, subscribe to Dream Blaze. Help us honor those who serve quietly, who lead by example, and who remind us that true greatness often wears the simplest clothes and speaks in the softest voices. Thank you for watching, and remember, the next time you're in a waiting room, look around. You might be sitting next to a legend.